Massage for scars and post-surgery. This online learning is a short online learning to help you understand the benefits with the science behind it and why massage for scars and post-surgery can be really beneficial and effective for our clients. We will learn some simple techniques that you can apply onto scars, but most of what you already know in your level 3 course can be applied in and around the area for scars already. The theory behind scar massage in this online learning will focus on the indications and the contraindications for massage for scars, as it's really important to know when you can massage after a surgery for scars or around the area, and also when you need to get that GP referral or a confirmation from their surgeon about whether you can provide massage to support them or not. This online learning will cover the basics of scar massage so you can start to integrate it within your practice. But if you do want to grow this area of your business, then we do suggest that you take further education in scar massage to provide this as a standalone appointment for your clients. So what we will cover, we're going to look at how scar tissue is formed. We're going to focus on the different types of scar formation that you may see within your practice. And lastly, we're going to focus on when and what sports massage techniques can help with scars, and also when you need to get that referral. This module is about understanding how scars are formed and how you can use those current massage strategies you already have to help with scar tissue. It's important to know that all scar tissue needs to be completely healed before applying massage techniques. There are definitely things that you can do if the scar is still healing, but direct massage work can only be applied to the scar when it's completely healed. I really like this quote. Scarring, the biological process by which normal skin is replaced after injury or disease, can negatively affect a client's physical abilities and psychological health. From Anya Kana. I think that's really key when we're thinking about scar massage and working with our clients with scar massage, as they've often gone through a process, through a journey to get to your appointment, and it's really important that we take care thinking about that before we go and apply scar massage techniques straight away. We need to think about them as a person and how we can help them in that long term. Some clients may have had quite a traumatic experience surrounding the reason why they have their scar, whether it's through surgery that they didn't want. There could be some sort of other trauma that maybe have happened. So you need to be mindful of that when you are meeting your client for the first time. Within treatment, there may be an emotional response after scar massage treatment. They may become upset, they may feel unwell afterwards, or their mental health may change, or their mood may change. So it's really important to be mindful of that when you're working with clients with scar massage. That may not always be the case. There's some clients that have had a really positive experience around their scar, and they come and have an even more positive experience with the treatment that you're providing as well. So it doesn't happen with everybody, but it's worth being mindful that that may have happened. And if you feel that your client's mental health has been affected or their mood has changed, then it may be worth having a chat about referring them to seek some mental health support, whether it's from a counsellor, a psychotherapist, to help them support them through their journey. Let's have a quick recap of the remodeling phase of the stages of tissue healing, because that's really important when we're thinking about this scar tissue formation. So the remodeling phase is where there is newly laid down connective tissue that becomes mature scar tissue. The type 3 collagen from the proliferation stage is reabsorbed by the enzyme collagenase into type 1, which is a lot more tensile strength than type 3. This is the process that reorganizes the collagen tissue, as type 3 is quite disorganized, and type 1 is orientated in those local lines of stresses. But the makeup is slightly different, and scar tissue mimics original tissue. So normal tissue, so normal collagen, is in a more of a basket weave pattern, where scar tissue formation is where the collagen cross fibers are cross-linked in a single direction. So they're kind of reorganized in one direction. So there's a different quality of the collagen tissue after a scar has formed. As we start looking into types of scars, we'll start with the fine line scar. And this scar is where there's been the right amount of collagen produced, and it creates just a really fine line, so just where that incision has occurred. It's difficult to see, it's blended in quite well, and it's healed very well. The next type of scar is a widespread scar, and this is where that fine line scar has been stretched and becomes a little wider. It commonly happens after around 3 weeks after surgery over tissue such as the knee and the shoulder where that tissue has stretched. Stretch marks are also variations of widespread scars where the skin is stretched quite quickly during a period of growth. The next type of scars are hypertrophic scars. Now, these have similar characteristics to keloid scars, which we'll discuss a little bit later in the module. This is where the body overproduces collagen, so overproduces that type 3, and the scar raises above the skin. But that does stay within the boundaries of the initial incision or wound. So it becomes slightly more raised, but you can still see the line of incision or where the initial wound occurred. It tends to happen around 4 to 8 weeks after the surgery, with a rapid growth phase that continues over about 6 months and then goes into that gradual regression and does start to slow down. And the collagen is the type 3 collagen, and it's made of a wavy but organised type 3. The development of these types of scars is not completely understood. Some suggest that it's around prolonged inflammation during the healing process, or a delayed epithelialization during the healing process. Or some have suggested there may have been an increased amount of mechanical tension during that healing time, but no one is completely sure why hypertrophic scars occur. The next is keloid scars, and these can occur within years of minor surgery, but can also form spontaneously, often around the mid-chest area, and we're not sure why. This occurs when the body overproduces collagen and the scar develops above and around and over the boundaries of the initial wound and incision. So it looks very different from the line of incision or wound that initially happened. So it becomes greater than the hypertrophic scars. It has a high recurrence after an excision procedure, so removal of a mole or removal of some type of tissue. And it's made of more disorganized type 1 and type 3 collagen fibers. So where that type 1 should have been reabsorbed, it's still around. It's a mixture of type 1 and type 3. Some research has found that darker skin is more susceptible to keloid scars. There was an increased risk of keloid scarring if someone is between the ages of 10 and 30 and of African American, Hispanic, or Asian descent. The causation of keloid scars is still really unknown, but some have suggested that it's due to a disruption within the wound healing, which makes sense because in the remodeling phase, you want that type 1 collagen to be reabsorbed and that type 3 collagen to lay down. So there may have been some disruption at that time, creating that disorganized type 1 and type 3 collagen, creating that keloid scar. The next type of scars are atrophic scars, and these are that sunken recess of the skin which creates a pitted effect. And it's commonly seen after conditions such as acne and also chickenpox. And lastly is the scar contractures. And these are a hypertrophic scar that forms a contracture across a joint. They're more common where the tissue often increases at around a 90-degree angle, so around certain joints. And they're also really common after a burn injury. These scars often happen before the wound has healed, and what some researchers suggested is that the myofibroblasts express actin and combined with growth factors creates a force that the unsutured wound edges move closer to each other, which is why it may happen across a joint. But the reasoning is still quite unresearched. So let's look at some of the benefits of scar massage. Research on scar massage is actually really limited. The studies that have looked into scar massage have been low in sample size and mostly on scars caused by burns. Many of the studies that are available focus on short sessions, some only 10 minutes a time for scar massage treatment. Some of the studies focused on pain reduction and the reduction of anxiety and distress, but others didn't. So a lot of the benefits and reasonings why we provide scar massage is fairly under research, but we know in clinic that it can have some really amazing effects for our clients. Some studies did find an improvement in range of motion, scar appearance, and decreased pruritus, which is that severe itching around a scar. Then other studies found there was no changes any of the above. The small studies that did look into pain reduction did see a decrease in pain reduction after scar massage. Now we know massage itself is great for pain reduction generally, so it's difficult to know whether it was a general massage session or whether it was focused specific scar massage. Even though the research isn't really there, which is often the case when it comes to massage therapy anyway, we still know there is a great need for scar massage in the work that we do. It's not just about how the scar appears and how it looks and changes from before and after with scar massage, but the improved movement that a client can achieve after that scar. There may be some protection, that nervous system protection around that area, and if we can help alleviate that, that person and that client can start moving better and also feeling better as well. Massage around internal and external fixation. So fixation is where there is surgical intervention, such as implants that are used to help repair a bone. And this can be done by internal fixation, so pins, plates, things like that, or external fixation, where there'll be some screws outside of the body. If your client has experienced an external fixation, treat this as a local contraindication, and no massage work can be applied around this area until the fixation has been removed and the tissue has completely healed. Massage around an internal fixation is to be dependent on the tissue healing time. So follow this module when it comes to massaging anyone that has an internal fixation. You want to make sure that tissue has completely healed. If a client has an old internal fixation and it's felt in any assessment or palpation, treat that fixation like a bony prominence and avoid that area with massage. So let's head into the sports massage guidelines for scar massage, wounds and surgery. The first stage is a bleeding in the inflammation phase. So we're going to start with that time frame from 24 to 48 hours up to 7 days after surgery or the initial wound. So the goal is to focus on the treatment of compensatory structures and help reduce pain. It's important to know what areas can and cannot be treated. You can massage your client in areas proximal to the wound, so anything above the wound itself, but not below. As an example, if you're working with a client that's had ankle surgery, then I would massage from the knee upwards and into the other leg rather than anything below the knee. You can focus on the compensatory structures, so other parts of the body, and non-injured tissue. But it's important that you avoid all areas of wound or the injury. So massage during this phase is really more global rather than local. So you can focus on helping that client reduce pain, restore ease, calm that nervous system down. Depending on what's happened, there'll be other areas that you can work on and support. If there's been an accident, there may be a muscle strain somewhere else in the body or a ligament sprain. So you can treat those accordingly, but avoiding that area of the wound. Next, let's focus on massage in the proliferation and the repair phase. So this phase is from 7 days post-surgery up until about 3 to 5 weeks. So the goal during this phase is to focus on the treatment of the compensatory structures as we did in the first 24 to 72 hours. Reduce pain, help reduction of pruritus, so that itching can happen in other parts of the body, so massage can help with that. Focus on an increased range of motion, and promotion or start to promote that scar pliability. With massage during this phase, the areas that can be treated is the soft tissue proximal to the wound. You can work on those compensatory structures and the non-injured tissues, but you can work on tissues closer towards the scar. If we refer back to the example of the ankle surgery, depending on how the scar is healing, then I may start to work closer to the scar. So rather than working above the knee, I may be working now below the knee and the proximal part of the gastrocnemius into possibly the soleus and into the proximal portion of tibialis anterior as an example. But it's really important to note that the scar itself should not be stretched. So any massage technique should not affect the scar in any way. During this phase, those general massage techniques can be applied to tissues around the scar, so thinking closer towards the scar, but still proximal. The massage movement needs to be carefully applied towards tissue resistance, so moving closer towards the scar, but not away. It's good to note as well that passive stretching can be applied to the tissues around the scar also. So we're going back to that ankle injury, and we maybe want to look at the proximal portion of the gastrocnemius and stretching that tissue there, or even into the soleus or tibialis anterior. But at all times, you are still avoiding the scar area itself. And now let's move into the remodeling and the maturation phase. So this phase goes between 5 weeks to 12 weeks to begin with. And this is where you can potentially start to massage the scar directly. But it is essential to get GP or surgeon sign off during this phase for any direct scar or wound massage. Now that's really, really important. So massage during this phase can be applied directly onto the scar, but we do need to get that sign off to make sure that the scar has healed. After that 12-week phase, the scar can be treated with massage directly as long as the scar is completely healed and it demonstrates no sign of poor healing. So after 12 weeks, if the scar has healed well, you don't need any GP sign-off to massage, but if there is a sign of poor healing, then you need to get that GP referral first. So during any phase of the scar tissue healing, always refer back to a GP or their surgeon if your client is experiencing any of the following. If there's still redness in and around the scar area, if there is heat in and around the scar area, there may be some swelling, if there's signs of scabs or bleeding around the area, and if there's that pruritus, that itching, always get your client to go back to the GP first before you apply any massage whatsoever if your client is experiencing any of those symptoms. So sports massage guidelines during this remodeling phase, and this is when the scar is completely healed. So our goal is to continue to focus on the compensatory structure treatment, so based on what else is happening with the client within the body, help reduce pain for the client as well. That reduction of pruritus, and massage can actually help with that. But if your client is experiencing, it's always worth getting them to go back to the GP first before they come for any type of scar massage. We can work on increasing that range of motion on the tissue directly over the scar, but range of movement at joints as well. And that promotion of scar pliability, so where that scar moves really well. Now during this phase, all areas can be treated. So areas above, below and on the scar can be directly treated. We can use techniques such as general massage around the area. Friction techniques can be applied in all directions directly over the scar tissue. And we show you some more gentle frictions within the scar practical video. Soft tissue release can be applied in both active and passive around the scar area and also directly on the scar. And we give you examples in the practical video also. Sports massage guidelines for scars. Take into account where your client is at the time of treatment and think about the whole person and the whole body. Some questions to consider. What is your client experiencing after the injury or surgery? Think about any trauma that may have occurred. Are they able to touch their scar? Before you go straight into scar massage, ask them how they feel about their scar. It's important to ease into the techniques and always focus on how your client is feeling throughout and get that feedback when you are in that massage session from your client. Start your techniques away from the scar, gradually moving in, and this can help your client gain confidence around the scar if they're not quite confident to touch it themselves or allow anyone else to touch the scar. And also think about what else needs to be considered as part of the whole treatment plan. Often a scar massage session may not be just one session in total, which you will see in the practical video. Think about that long-term treatment plan and what you're trying to help your client with. There may be more exercise involved if it has been post-surgery, post a sprain or an avulsion fracture that may have happened. So think about what else needs to be considered rather than just solely the scar massage. Think about the home care as well and what that home care may be. It may be self-scar massage, self-massage around that area. It may be breathing relaxation techniques to help if the client has been quite anxious about the scar or the surgery itself. Or it may be exercise depending on what has happened. If your client is experiencing an avulsion fracture as an example, or a sprain that's required surgery or a fracture, then exercise is actually key during this phase to get those tissues loaded again. So that may form part of that home care plan. Instrument-assisted massage is another modality that may help if you are qualified to apply these techniques to a scar. And there's not much research behind it, but in clinic we've seen some really good results with combining hands-on massage with instrument-assisted massage work as well. So following on from this, I want you to watch the video in the next online learning of how to integrate sports massage techniques with scar massage. And here are some of the further reading and resources based on what we've covered in this online learning.